Hi, welcome to the Stellar Physical Medicine Educational Series. My name is Dr. Lloyd Wright, and I am here to share with you some of the interesting treatments that we have discovered with regard to how Chinese herbal medicine treats COVID-19. In recently history, since the COVID event, a lot of people have been suffering with what's known as post-COVID symptom, with a variety of symptoms from brain fog to just low levels of energy and fatigue. So we're going to take a look at how did Chinese medicine treat this? What are the real secrets? I'm going to offer some very practical things that we can all use in our everyday life. And it starts with what I call the secret of the 6 pathogenic factors. But when we wrap this up, we'll talk about some of the science and some of the treatments that originated out of Wuhan to treat the acute condition of COVID-19 as well. So let's take a look at how this all started and how long Chinese medicine has been around. First, a couple quick notes about myself and my own experience. I've been practicing traditional Chinese medicine acupuncture since 1985, over 41 years. I'm board certified as an acupuncture orthopedics. I've served as a qualified medical evaluator for the California Workers' Comp System, and I have a practice focus in respiratory disorders such as influenza, allergies, asthma, digestive disorders, pain relief, and women's issues. I particularly got good at respiratory disorders and influenza. Why? Because I personally would catch everything that would come into town. So I got very good at mastering herb formulas that really worked very effectively for influenza and have treated influenza for the past 40 years. I currently practice in Scottsdale, Arizona. So let's take a little deeper look at traditional Chinese medicine. First, a few historical notes about traditional Chinese medicine. It has been around well over 2,500 years, and that's when the first documentation started back in the Qing dynasty. However, it has experienced over 880 epidemics and plagues during the past 2,500 years alone. The first books written on how to treat febrile and cold diseases started in 950 AD, and it was written and compiled by a famous Dr. Zhong, whose family was severely wiped out by these plagues. I think typhoid was one of them. And he basically developed the Shan Hanlan, or the treatise on cold disease, cold and febrile disease, which turns out to be an algorithm of how to treat illnesses depending on what level they are. If this, then you treat with that. If that, then you treat with that, and so forth and so on. It's quite an amazing book. And it was the beginning of formal treatment and formally defining how to handle and treat plagues and epidemics. Well, the ancient Chinese got very good at it over the past 2,000 years. So take a look at one of the primary things that we look at, and it really relates to what we call pathogenic factors. So according to traditional Chinese medicine, or TCM, a pathogenic factor is an element that causes interference with the normal healthy function of the body. That includes the organ functions. Now, in my previous video on 5 elements, you may recall, or if you haven't seen it yet, go take a look at it, that we analyzed the relationship between the organs and the functions of the organs and the symptomologies related to the organs themselves. Now we're going to talk about influences, external influences on the body and the organs. So the next picture is understanding what these factors are and how they cause organ dysfunction. So the 6 pathogenic factors are listed on the slide here, as you can see, and they are wind, cold, dryness, dampness, heat, and an unusual condition called damp and heat combined or intertwined. So these factors can be generated or can come from what we think of as internal, or it can be external. So we're not going to discuss the internal component of these factors today. We're going to focus more on the external. And if that sounds like we're talking about the weather. Yes, in fact, we are. Externally, do we have wind affecting us? Cold, dry, damp? All of these are, in fact, common external environmental factors. So all of these can be independently affect us, or they can sometimes combine and affect us at a, a multi-level function. So let's dive in and we'll take a look. And at the end, we will start to take a look at how this fits into the theory of treatment of respiratory infections and particularly of COVID, and how understanding these factors steers our decision process in choosing the right herb formula and also making dietary recommendations. So let's keep in mind, diet is something that we all choose. You don't have to go to a doctor to understand diet. Getting the right herb formula, probably you should be seeing a good herbalist. But diet, you can figure that out yourself, and we intend to help you with that today. Okay, let's take a look. Okay, so first up is wind symptoms. Wind can be gentle and easy and breezy, or it can be very strong, or wind could be a hurricane, environmentally speaking. But in terms of symptoms, it is said in the ancient text, the wind is the carrier of 100 diseases. So common symptoms related to the wind could be tight muscles, spasms, tremors, twitching, allergies and hay fever symptoms, general sense of body acheness or headaches or pain that rapidly moves around the body. A sense of restlessness, sometimes an itchy or maybe even a scratchy throat, nasal obstruction, and just plain discomfort in winds or drafts. This might particularly show up if you're in an air-conditioned office in the middle of summer and you happen to be under the vent and that draft is blown right down on you. It may become quite uncomfortable. So these are the common symptoms. Let's see how they apply. Let's take a look at a typical case study of a wind condition. So let's consider the following. We've got a 28-year-old male that comes into the clinic with complaints of feeling chilled, mild sore throat, slight cough, general body ache, muscle stiffness, and most importantly, fatigue. He reports that he spent the prior evening watching the ball game, and he notes that it was windy during the ball game and the weather was a little chillier than what he expected, so didn't quite dress for that. Let's take a look at what's next. So let's start with the diagnoses. From a Western or allopathic point of view, we would probably say he's got the common cold or a mild virus. The traditional Chinese medicine diagnosis, however, is a little bit different. We would look at the evident pathogenic factors. So we would conclude that he has a combination of wind and cold or wind chill. So what is the solution? And this is where traditional Chinese medicine really excels. So with every case that walks in our door clinically, we want to identify the pathogenic factors or factor. If it's one factor, great, but no law says you can't have more than one thing going on at once. So in this case, we look at his symptomology, and wind is evidenced by his complaint of general body acheness and also the fatigue. Cold is indicated by the fact that he feels chilled, and also he notes that he was actually exposed to cold the night before. So it makes sense that he's got a combination of wind and cold. So the next question is, what to do? There are 4 points in traditional Chinese medicine that I like to boil things down to. Very simple. If it's too hot, cool it. If it's too cold, you warm it. If it's too damp, you dry it. If it's too dry, you moisten it. Very simple, very logical. Okay, so what's our treatment principle? In this case, we don't really want to cool because there is no heat. Our case is already feeling a little chilled. And we don't want to moisten because he's already mentioned a little bit of stuffiness in the nose. So he's got too much mucus. So the basic principle is we want to warm and dry. Now, how do we do that? in Chinese medicine, mostly through herbs and also through diet. Now, all herbs and all foods have a nature of either being warming or cooling or drying or moistening. So we'll take a look at those. So I love to start off talking about herbs that are easily accessible for the common household. Herbs that actually work, but they work when they're applied to the right conditions. So it's just a matter of matching up what herbs are going to be warming and drying for this case. So there are a couple of household herbs that do exactly that. Probably our favorite all-time herb is ginger, which is an amazing herb in itself. It has a lot of healing functions, but we just keep in mind that it is warming and it is drying. It also will help with digestion. It also helps with some degree of liver functions and has anti-inflammatory functions. But our focus here is the warming and drying function of the ginger. Now, cinnamon is also warm and dry, so cinnamon could also be applied to this case. Garlic is also warming, so good to cook with garlic. We know garlic has antibiotic functions and antiviral functions as well. Chili peppers are hot and drying, and they're in the right category. They're just not my first choice. Sometimes they're a little too hot or too dry. Based on my personal and my clinical experience, I do believe traditional Chinese herbs work the best for respiratory infections. Traditional Chinese formulas are available over the counter in some of the classical formulas, such as Ganmei Ling or cinnamon twig decoction. Cold break was a formula developed in our clinic based on ancient formulas, usually eliminates these symptoms in 12 to 48 hours. Now, classically, traditional formulas were modified to dial into the precise configuration of the presenting symptoms and pathogenic factors. So that's always something to consider. In conclusion, I have a question for you all. Have you experienced wind symptoms? Do you now have some ideas about how you might deal with wind symptoms a little bit differently in the future? In our next video, we will take a look at some of the other pathogenic factors and how they mix and how they match. We'll take a look at the unique combination of pathogenic factors that were presented with the COVID-19 virus, and what 3 herbs were found absolutely critical to include in all COVID formulas, as well as which hospital in Wuhan actually made that discovery. After that, we'll take a look at some of the science studies that have been conducted since then to discover the effectiveness of the COVID, and we'll wrap it up after that. If you've enjoyed this video, we appreciate you hitting the like button, the share button, and the subscribe button, and we look forward to seeing you on the next round. Thanks for watching.